Hi everyone, I'm Laura and I'd like to welcome you back to the Transforming Health podcast, brought to you by Johnson & Johnson. In this series, we'll look to the future of healthcare and explore challenges relating to investment and equitable access to treatment. We'll look at why these challenges exist and what's being done to overcome them. And we'll do so with experts who work in this space every day. I'm here with my colleague, Giuseppe Pompilio, Director of Market Access at J&J Italy. Welcome, Giuseppe.
Very nice to meet you, Laura, and thanks for inviting me here. Thanks a lot.
Great to have you. So today, we'll be looking at a critical issue, the challenges of an evolving healthcare system and the mismatch in the training of healthcare professionals. We'll explore the reasons behind this mismatch and discuss potential solutions to better equip future healthcare professionals. Giuseppe will provide insights into where education programs can be improved and the significance of continuous learning and the evolving roles within the healthcare industry. So to kick off our discussion, Giuseppe, how did J&J Italy identify that there's a gap between the training of healthcare students and the actual needs of the healthcare industry?
Thank you, Laura, for the question. So we started from two key factors. One in external, because here in Italy we have a situation where the number of physicians is progressively decreasing. So we are in a situation where it's been already declared that by 2030, the number of physicians will be reduced by 30%. So there is a huge gap in terms of people involved in healthcare. On the other hand, there is the J&J perspective. We are a global company. We are fully focused on deliver and provide innovation, and often we're able to provide disruptive innovation. This is definitely cool for us. But on the other hand, we have to be conscious that sometimes the environment is not so ready to embrace as we want this kind of innovation. So why not work with physicians that, on the other hand, are decreasing in order to support them in implementing their competencies, facilitating them to further embrace our innovation, not only understanding how to use our technologies, but also supporting us in identifying different patient pathway. Because unluckily, so far, we are seeing, especially in some critical areas, where the patient journey are very old-fashioned ones. So why don't support them to embrace our innovation and adopt it in a different way, for instance, including also the artificial intelligence, or in a way where the change management can support them in this kind of change.
Got it. And these two together helped you to realize that there was a problem. And I hear you were part of an interesting partnership to dig deeper on this.
Yeah, you're right. Not easy to define a partner, because in this case, our aim was to identify someone where we can work in terms of peer exchange. And luckily, we identified Altems, that is a graduate school, high-level school for health economics and management, where we started this conversation and we found out some common goals. So we fixed this project together. And through Haltems, we identified the participation on 3 different universities. So through these 3 universities, we involved also students that are already physicians, because they are moving to be more specialized, and also nurses. So I repeat, we saw a really good engagement by them. So this was very important in terms of receiving some very, very robust from a statistical perspective.
Right. So you had undergraduates, you had graduate students, you got a really good profile that was representative of across Italy. And what were the findings of the study?
An area of soft skill is the one where we found a huge gap between the current preparedness of students and what is expected by future roles. What we saw is that going deeper, there is a situation where there are 2 main areas among all several areas identified. One is the managerial skills, and the other one is the concept of hybridization. our interpretation on the reason why they highlighted as a student these two areas is probably to be connected on something that is the sustainability concept. Because we all, probably not only in Italy, but everywhere, we are to facing on a daily basis on the concept of sustainability, trying to manage it in order to avoid austerity measures. Something that is unfortunately happens, and this happens more and more by time. So this was probably the reason why the students of medicine are now asking, okay, I would like to be prepared as a manager. I would like to be prepared more on how to stay connected, not only with physicians on my specific specialty, but also with other physicians and maybe also with other roles, for instance, including AI, for instance, including some other roles, not only physicians. This was something that honestly impressed us.
Right. So you think that students and teaching professionals can see that they're not going to be able to kind of practice one discipline in its purest form. They will need a broader skill set eventually.
Exactly, exactly. See, so they are now already living this need. And this is something that honestly further impressed me, because when we started to think how to improve the current training course in order to make them satisfied, the time needed to bear through it is roughly 10 years if we start now, because this is the length of the training course. It's also something that generates a sense of urgency. We all know we all are in this situation. We received this request from students, but we also need to understand that we have to start now. Otherwise, it's too late.
Yeah, and I guess if you're saying it feels urgent now, it was probably actually urgent 10 years ago, if that's the gap, which means we really have to move quickly.
Yeah, definitely, definitely, and consider that. I mean, on top of the sustainability concept, we have also to consider that some enablers that probably can support all of us. One of these is the AI. The AI so far has been used in a probably tactical way. Maybe there is the need to start from AI in order to revise all the patient pathway already identified, uh, even in order to embrace the innovation that we are able to provide. And another topic that has been highlighted is the concept of change management. I mean, I found all this very tricky because, we are now discovering how the public that we consider far away from us is working on something where we have been struggling for many years. So these are topics that are not new for us. So this is something peculiar, and this is the immediate answer to how we can work close to public, to stay together, and to suggest them something that probably we have already implemented.
Right. So it sounds like not only do different healthcare professionals need to hold hands, but actually the public and the healthcare professionals need to interact and feed each other a little bit more. Do you think new roles specifically will be required in healthcare?
Yes, I think, but I prefer to report what the study highlighted, because also Altems, I mean, I believe that they are definitely more qualified than me, and they suggested many roles, honestly. Uh, we identified three as the most important. And probably some of them are not new roles, but there is an upskilling of some roles already existing. The first one is the healthcare 4.0, because healthcare director already exists, but maybe from now on is requested a more strategical approach from this role. So a strategic plan and time, specific time to implement it in a way that is not tactical. So this is the first role they identified. The second one is connected to this one is innovation manager. I'm laughing because I mean it's something that already exists within the pharma companies, no? And they very punctually identified the innovation manager as the guy has to be responsible to facilitate the full adoption of innovation. And when we talk innovation, we have to include our technologies. And the third one is the patient process manager. They are declaring how they are fully specialized on diseases, but sometimes they forget the patient. And now we are all recognizing how the patient is suffering more than one disease. So there is the need to connect in a multidisciplinary approach all the people involved. And probably this guy that is the patient process manager has specifically this role to stay concentrated on the patient in order to grant taking care of this of the patient door to door. So these are the three identified, and I believe, I mean, I repeat, I see some similarities on some roles that we have identified within the companies.
Yeah, that makes sense. And it's interesting to hear that the roles are in place to an extent already, but perhaps they're not formalized, or they're not the expectations aren't widely shared. And putting the patient at the center, being more patient centric, will be important in the future. And what impact do you think that will have on patients in Italy?
The impact expected is to try to manage the lack of physicians that we are going to live in. We are still living. So the impact is trying to, on one hand, improve the quality of single physicians in terms of improving their competencies, because if they achieve also some competence from managerial perspective, despite they are not general director or health director, but they can understand and they can implement by themselves something in order to make their environment more sustainable. And for us, this means to adopt patient journey, patient pathway a bit different from one that's been adopted so far, because probably are old-fashioned and are not able to embrace innovation that pharma company are going to deliver. On the other hand, is the concept of hybridization, I repeat, because if they enlarge their boundaries, they can cover some space that otherwise are not covered. So this is something that I expect will optimize. I cannot say that this will solve the issue, but for sure will optimize the situation that we are currently living.
Yeah, and you made the interesting point there, Giuseppe, that for the pharma industry, in order for our innovation to stick and reach patients, it's important for us to play a role in this bridging between the education and the industry needs. What do we need to actually do as a pharma industry to be an effective bridge?
I mean, we are already doing a lot of things because, for instance, CME is an expression of this. Uh, I would like to summarize in one sentence saying, okay, we need to stay close also to this topic. This is something that we have to consider as a part of our job. Is not anymore something that someone else has to improve. So is a part of our job staying close, because we are now seeing that we are already implementing roles that our customers are thinking to implement. So why not share our experience, probably the mistakes that we made in the past, in order to support them and to avoid that they do the same mistakes that we did in the past. So a different way of working. I mean that as happened along the COVID situation, uh, let's take the positive thing, if I can say, in terms of generate a sense of urgency and understand that we can work together because we have something to share, and not in a way of sponsoring, in a way where we can in a peer exchange. And we are sharing by function our expertise. As I was saying before, we have done a lot, they have done a lot. Let's stay together, let's share it, because probably we can learn each other side by side.
Yeah, that makes a lot of sense. That actually the pharma industry is learning and failing and getting some things right, but we can share that really effectively and partner in the true sense of partnership with academic institutions. Fantastic. And that sounds like a great point to end the conversation, Giuseppe, and a kind of optimistic look to the future as we partner with different institutions. Thank you so much for your time.
Thank you, Laura. Thanks a lot.